Well, the death of superstar Whitney Houston has once again put a spotlight on Hollywood doctors who cater to celebrities. Should physicians who give medications to people with a history of addiction be liable if their patients die from the drugs? And are Americans in general, forget the celebrities, the rest of us, are we too quick to ask for pills when we're in some pain or we feel sad? Joining me now is Professor of Medicine at NYU Langone Medical Center and Fox News contributor Dr. Mark Siegel, and psychiatrist and Fox News contributor Dr. Keith Abloh. And gentlemen, let's start with you, Dr. Keith, on this business about there's a pill society today and we're pill happy.
Well, I think that we've gone in a wholesale fashion in that direction in psychiatry, much to our detriment. The ability to reason with people, to get to the bottom of their life stories, is a dying art. We need to resurrect it. Certainly there are pills that are incredibly powerful. Look, anti-anxiety medicines, antidepressants, pain medicines, they have their place. But we have too quickly abandoned empathy as a mode of healing. Someone needed to get to the bottom in Whitney Houston's life. What's wrong? Why would you want to medicate yourself and anesthetize yourself? It's always because of emotional pain.
Dr. Siegel, there's one of our producers here was talking about he went in, he had some back pain, and the doctor said, let me give you some Valium. He said, no. Is there something else we can do here first? Are doctors too easy to prescribe a pill?
I mean, absolutely, Tom. To continue on a theme Dr. Keith started here, which is it's about the doctor-patient relationship. It's not about prescribing pills, enabling people. You've got to be able to answer the question, why are you giving that pill? I mean, if someone's medicine cabinet has in it Ativan, Valium, Xanax, 3 different sedatives, I would ask right off the bat, why you need 3 different sedatives when they almost do the identical thing? What about one? What about none? Painkillers, and you talk about painkillers, 70% of the painkillers in this country end up being taken by different people than the ones they were prescribed for.
Oh boy.
That's out of control. 400% increase of accidental problems with prescription drugs over the past decade. 400%. It's the #1 cause of accidental deaths in the United States. #1 cause of death is prescription drugs. Not even motor vehicle accidents anymore.
This is the problem, is it's growing so rapidly, this whole business. But we talked about this on the radio show, and we got a call from William in Rocky Mountain, Virginia. He's an anesthesia nurse. He says doctors are too quick to dispense pills and patients are too eager to take them. William is our caller of the week.
You also have this social ideology going on nowadays that people aren't supposed to have any pain whatsoever. You're never supposed to be depressed. If my cat died, doesn't mean that I need to have a prescription.
Yeah, Dr. Abloh, I mean, if my cat dies, it's okay to be sad, isn't it?
Well, listen, here's the thing. There are people with major depression. They need treatment. No question. And we have a powerful armamentarium to deploy. However, right now, the American Psychiatric Association is about to release the DSM-5, our diagnostic manual. They've added grief as an illness. You've got the professional association that represents...
That's just part of the range of human emotion.
It's insanity. What is it? Let me tell you what it really is. It's parceling out the field of human emotion as disorders so you can bill for treatment for it and match it to a medicine. Because that's how doctors, sadly, some doctors want to get paid. Sadly.
How big of a problem is this in the doctor community?
Huge. And to add to what Dr. Keith is saying, on my side of the fence, there's pain. Pain is something that's supposed to be connected to an operation. You got an operation, you got pain afterwards. You break an ankle, you got pain afterwards. But we love this expression, chronic pain. And everybody has chronic pain, Tom, and they're going to a doctor and they're getting medications. And you know what? Those medications are addictive. The more you take of the opiates, the narcotics, the more you end up needing of them. And there's whole businesses that grow up around the overuse of narcotics.
Well, and they now, I don't know how many years it's been now, 5 years, something like that, where they've allowed prescription drugs to be advertised. And I got some doctors that called the radio show, and they were not happy with me. But my point is, I thought you doctors were supposed to be kind of the gatekeepers, and who am I, who have never been to medical school, to come in and tell you what prescription I need?
Listen, the vast majority, I think Dr. Siegel, I don't know whether to call him Mark or Dr. Siegel because we're friends, right. but in any case, the vast majority of doctors do a good job at this. And it's tough because people have been trained to ask for immediate relief. So if you say to them, now look, I really want to get to the bottom of this with you, and if I mask the pain, we're going to be that much further behind. You have sort of a hostile audience for that. It's the outliers who are most at risk to do this. And now, unfortunately, organized medicine. Can you imagine not only grief being classified as an illness, but shyness? They want to call shyness a disorder.
Oh boy.
I don't know how the president of the American Psychiatric Association goes to work anymore. What are you doing? You're getting together as a committee and inventing new disorders?
Here's the other problem. When medicine was, you guys were a bunch of small business people. You had your shop and you hung your license out there. Now it's group medicine. And I had an ER doc call the radio show, and she was telling me that they now have patient satisfaction rankings and their jobs are in jeopardy. So if I'm the patient and I come in and you don't give me what I want, I'm going to write you up, doctor, and you're going to be in trouble.
Well, that's part of the problem. But the other part is that the rules are too lax. I think we doctors have too many choices. I don't think there's enough restrictions. Now, you know I'm not a big fan of excess regulations, Tom. You know that. I've said it on the show before. But in this case, doctors should know that they can't get away with doing this. And what about pharmacies? There's a single pharmacy in Beverly Hills here that's been prescribing for celebrities all of these things without necessarily checking enough. I think that pharmacies have to be held accountable too.
Well, we got into this with the audience, this whole business about Big Brother and Liberty and about having a record so that if I went to you to get a medicine and then I thought, you're going to cut me off, or maybe I want some more, I'll go to you and I'll go doctor shopping and the pharmacies say in some cases they have databases that will know, so you can tell that I'm getting the same medicine from Dr. Siegel.
Which is tremendously important, right? But ultimately, you have to be a good doc, right? Because people aren't necessarily the best arbiters of what they need. That's what they're coming to you for.
Exactly.
So you got to be able to say, okay, look, we'll take care of this pain for a while for you, but you got to tell me what's going on in your life. Right? That's the connection that we need to make. And you won't find me arguing with insurance companies on the phone. You know why? I don't take insurance. I couldn't take it anymore. I don't want to be told how to practice. I'm in Massachusetts where Omnicare is. It's no better than it was before or worse.
Yeah. Medicine's going in the wrong direction in this regard, away from what the principles that Dr. Keith is talking about. But I got to tell you, Tom, there's nothing more gratifying than when one of us sits there and figures out the solution to a problem that a patient is having without medication.
Yep. I like it too as a patient. Thank you, guys.
I'm going to go to you.
I'm going to go to you.
We solved that problem. Now the rest of America.
They'll say I'm doctor shopping. Anyway, thank you guys both very much.
All right, take care, man.